Greetings, friends and followers. This is Nurses Talking, and I am Dale Barzi. As always, if you like what you see and hear, subscribe. Leave us a comment. Let us know what you think. Here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey, from students to retirees and anywhere in between. Today, it is my great pleasure to welcome Donique Layne. Donique is a psychiatric nurse on the island of Montserrat, and she attended Montserrat Community College and graduated in 2009 as a general registered nurse. In 2014, she attained an associate's degree in psychiatric nursing from Barbados Community College. In 2023, she got a BSN from Walden University with applied psychology, and may I say she graduated cum laude.
Mm.
Her personal goal is to become the best version of herself every single day. And she's striving currently to a master's degree in developmental psychology, and later she wants to attain a doctorate. And she says that her dream is to create a wellness center to provide a range of specialized services to children with special needs in Montserrat. So, welcome, Donique.
Thank you. Thanks for having me.
Your dreams are huge, and I love that. I love that. But first of all, what made you become a nurse? Who or what influenced you?
Good question. There are so many things. Growing up, I grew up in a single parent family. My mom, she has 3 girls, and my dad wasn't always around. And I saw how my mom struggled, to raise myself and my 2 younger sisters. And sometimes, when you live in extended families as well, because we had cousins and other relatives around, not necessarily living in the same household, but, in the same neighborhood.
Yeah.
And you see people get ill, and sometimes, they're unable to access care that they need because maybe the hospital or the clinic is so far away that, by the time they get there, it's too late and that kind of stuff. And besides that, I was always curious, wanting to know what it was like to be a nurse, what it felt like. And every time my mom or a relative asked me, what would you like for your birthday? Or what would you like for Christmas? I will say, I would like me a medical kit. Because I want that thing that you put around your neck, and you walk. I had no clue what the name was, but eventually I found out what it was. But that was my excitement. And I would sit in a corner and play from morning till night with my toys, pretending to be a nurse or a doctor, curing people, making them better. Sometimes I remember running around the house saying, Mommy, come, let me check you. Let me check you, And it was fun for me, but surprisingly, I actually developed a love for people. I consider myself a social butterfly. My love for people and helping people, it just came naturally for me because if I see someone in need, they don't have to ask me to reach out, to help them. I will just gravitate and just do what I can to help that person. And with that in me, when I left secondary school and I did a school leavers program, there were 2 individuals I remember who were like, we see something in you. You could be a really good nurse, are you interested in nursing? I was like, yeah. And, and they were like, you can do this, just join the program and let's see what happened. And that was it. I joined in 2006 after I left school. And that was it. That was it. Just took off like a jet.
Pretty cool. So, Donique, having wanted to be a nurse all your life, having been attracted to nursing, when you became a nurse, was it what you thought it was be?
I think I deep down inside, I probably wanted to be a nurse. There was something inside of me that, pushed me because I really did not resist, when persons encouraged me to go into that field. I didn't put up a resistance or say, I need to think about it, that kind of stuff. I just jumped right in. So deep down inside, I think that there was something in, they're saying nursing is for you, in regards to my expectations or what nursing is when I joined, And did it meet my expectation? I am not sure because I didn't go in with much expectations really, besides the fact that I know that I'm going to care for persons and make persons better. But my training has taught me what nursing should be, or how a nurse should be, or how she should portray herself, him or herself. What are some of the things that are expected of you as an individual in that field? And knowing those things, from my training, and actually started working as a nurse, seeing what is happening in the forefront on the ground. It's totally different to what you learn, in school. There isn't that balance where the book says this and this is what is actually happening. It can be a total different situation altogether. But I must say it was a lovely experience. Um, I didn't have much challenges in terms of trying to adjust to the real world situation coming out of classroom setting. It wasn't much of a challenge. But like I said, there were some situations where you go back, classroom taught me this, but in reality, this is something else. But yeah, I did have those light bulbs going off one or two times, trying to say,
Yeah.
well, what's really happening here?
Yeah, I know. You tend to get in classroom setting, they teach you this, these, and these steps. And the thing that I think we forget in teaching people is to remind them that these steps are really guideposts, because
Yes.
you're dealing with people, and as long as you're dealing with people, there's going to be so many variants.
Yes. I think a lot of time we forget that aspect. Because classroom basically teach you what you need to know, the groundwork to get you
Yeah,
going. But when you
yeah.
get to the real world and you have to actually deal with people, there are so many personalities, so many attitudes, there are so many
Yeah.
things contributing to a person's behavior that
Hmm.
the classroom did not teach you how to handle that.
Hmm.
A
Hmm.
lot of
Hmm.
things you would have to learn as you go along.
Yeah, yeah. Yeah, yeah, and that is one of the things that I notice we are stressing more um in education. It's the thing is that you really have to think. You have to apply what the situation is, and figure out how you're going to use your knowledge to meet this situation.
Yes.
So what made you choose psychiatric nursing though?
That was my response to that question is very, very close and dear to me. My mom, she, in her late adult years, she started developing mental illness. At that time, I had no clue what it was. My family did not know what it was. We just thought that we knew she was sick, but we didn't know what her sickness was. And because family members did not know what was happening, they treated her, poorly. And it destroyed our family, basically. My mom and her sister, they got into fights all the time. They could not see eye to eye. The relationship broke down over the years because nobody knew what was happening to her. This is the first time we're seeing something like this. We don't know how to deal with it. And that was scary for me because I was still a young girl. And then on top of that, she did not receive care because
Yeah.
nobody knew what it was or how
What?
to deal with
Hmm.
it or how to even approach it. So she was left without any formal care or assessment or anything to really figure out what was happening with her. And after I joined nursing and it continued and she just continued to get worse. And I was like, no. So after I started having little knowledge as to what is going on, and seeing other people, experiencing similar situations and, how their life is actually, being improved with the help that they're receiving. And I'm like, well, I think this can work for her as well. So because of that, and I saw firsthand that, lack of knowledge can actually prevent someone from receiving care or getting the help
Yeah.
that they need. I thought, since, my mom is not in a position to receive that, maybe I need to go down that road so I can actually help her and also help other people who might be in a similar situation like her, and prevent them from being stigmatized or, just being shoved in a corner or a closet and say, you stay there because you're just different from everybody else. So that really drove me to be in psychiatry. And I actually developed a passion and a love for it. When I actually started my training, I was like, wow, I'm actually liking this, And fortunately for me, even though after my training and I came back and started working, my mom, she was still not settled, and she was still not receiving care. And from that, I made it my duty, to get her the care that she needed. I started doing my own assessments on her, you know, started to introduce her to certain medications. Of course, I would liaison with the psychiatrists or the doctors
Yeah.
that I work with to get their opinion on things. Because I was living in Montserrat and she was in Guyana, because originally I'm from Guyana. So there was that distance between us also. But I still wanted to help and make sure that she was doing okay. She was, getting the care that she needed. So the story with my mother is what literally drove me into psychiatry. And then in no time, I actually developed a love and passion for it. And I'm here how many years later? Still in psychiatry. Yeah.
So, so as you mentioned, you're originally from Guyana. You're now living in Montserrat, and you've lived in Montserrat, you said, for like 20 years. I
Yes.
know that you're probably the only, for anyone who's listening who's not familiar with Montserrat, Montserrat currently has about 4,000 people, somewhere around there, right?
Somewhere around there.
Yeah. Um, and the circumstances surrounding that are not even relevant right now. But anyway, um, so you're probably the only psychiatric nurse there at the moment. Am I correct?
Yes, I am the only, well, at the moment, there are two of us, but prior to the other person coming, it was just myself for a number of years. From the time I left training and came back, it has
Yeah.
just been myself. We've had other persons come in, but they didn't stay for too long, just a couple of months, maybe a year, the maximum, and then they get frustrated with the system and then they left. But I've always been here and I'm still here. But I do have another colleague at the moment. She is a community psychiatric nurse practitioner who,
Mm-hmm.
who recently joined the team. So I'm
Mm-hmm.
grateful for that support, in that area.
I have two questions now regarding that. One is, are you finding that, well, so initially, just now I mentioned that there were only 4,000 people, and I kind of said that I wouldn't go into the circumstances surrounding that, but perhaps I should, because the question I want to ask is, do you find that there's a lot of mental trauma to people in Montserrat? And the reason I ask that is, for explanation, is that Montserrat has gone through quite an upheaval in the last few years, where it has lost a lot of its population and a loss of its infrastructure and even a lot of land. So that has had to have some kind of traumatic effect. And I'm wondering how you see that as a psychiatric nurse. How do you see it playing out in Montserrat right now?
Yeah, and that's a really good question. It does have an effect on the people. I mean, as you said, rightfully, the Montserrat has been through a lot, over the years. Natural disaster has really taken its toll on the island, causing people to have to lose their homes, relocate, they lost land, and
Yeah.
so forth. And I don't think when it happened, persons really took the time to talk about it, talk about how they feel, how has all of this affected them, and that sort of stuff. They just basically had to uproot everything and just move,
Move. Mhm.
And there wasn't much work done in terms of, trying to assess, the psychological or the emotional effect of
Yeah.
that and actually putting things in place to support the persons who were really, really affected by this, So many, many years later, you see persons are developing symptoms of, emotional distress. They're coming down with what do you call it, late onset psychosis, that kind of stuff.
Yeah.
And when you do the history, a lot of it has to do with the trauma that they would have experienced in those years, and
Uh-huh.
not being able to effectively deal with that or address that issue, and it's now playing out. It's not so much with the younger generation, because at that time they would have been really, really small, or some of them
Yeah.
even
Yeah.
born yet.
Yeah.
But
Yeah.
all the population, the ones that are still here, you can see that there are some emotional trauma there that's coming out in one way, and it's manifesting itself in one way or the other. And
Yeah.
it's really affecting people.
Yeah.
Yeah.
Are you finding that people are willing to seek help?
It was hard in the beginning. When I started, persons did not like talking about mental illness. It's not a topic that was
Yeah.
discussed openly. And, more and more over the years, we have seen improvements in that, because we've done a lot of education, public outreach, trying to get people educated about what it is,
Yeah.
and
Yeah.
get people comfortable with actually talking about it. So with all the work that we would have done on the ground, we have actually noticed, some improvements in that area, where persons are more open to talking about their feelings, reaching out for help, coming and accessing the service, versus what it was when I started out,
Yeah.
So there has been mass improvement over the years, with regards to access, and of course, persons being willing to come and access the care and
Yeah.
service.
Yeah. 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 So you're finding that the stigma around mental health is lessening?
It is. There is still a lot of work to be done, because we can't fully get rid of stigma. It's gonna be there. However, a lot of improvements has been made, and you can see, the improvements, when you look at where we started and where we are now, a lot more persons are accessing the service, even just, and it's not only when the need for the help is that great. From the time persons realize, listen, I'm having a tough time dealing with this situation, I need to talk to someone, they are reaching out. So we know that we're reaching to them, and in turn they're reacting,
Okay.
the way we expected them to.
Okay. 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 That's awesome. That's awesome. Now, the other question I have is that, as we mentioned, it's a very small community.
Mhm.
Um, and not only is it a very small community, it's an island community. So although it's really a global thing, it's still kind of cut off. How do you see, how would you like to see technology incorporated in your nursing practice in Montserrat?
Currently, there has been a lot of work going on around that. We used to do a lot of paper-based reporting and documentation. And, the question has always arisen, what if, something is to happen again? How are we going to secure our records? How are we going to
Yeah.
secure, this sensitive information and stuff, and protect people's information? And now that you're asking that question, I'm actually happy and excited, because our government has invested a lot lately in terms of putting in place an electronic health system.
Yeah.
All staff has been trained, and we are halfway through rolling the system out. From my unit, mental health, we have been fully using the system. They have done several test run and trials, and the system is working. It's working, and it's going good for us. And I'm excited because it allows you to do a lot more than just record and store. It allows you with how you care, how you collaborate with other professionals
Yes.
and provide that
Yes.
care. So there's minimum risk for duplication or even errors. It actually allows you to follow up closely with your clients also. So there's a lot of benefits, using
Yeah.
technology and incorporating technology. And we do a lot of telehealth medicine as well for psychiatry, because we do not have a base psychiatrist. So we do telehealth medicine every week via, media. So technology has played a huge role in terms of improving our practice and services that we offer.
That is awesome. That is awesome because
Yeah.
it gives you the opportunity to reach. It expands your reach so much.
Yes.
That is it's fantastic. What what would you like to see change? What is the biggest thing you think you'd like to see change in nursing in Montserrat?
The biggest change I would like to see. Um, that's a tough question. Uh, uh, in
We
terms
can
of
come back to
change,
it. Hmm.
yeah, in terms of change, I think, I would like to see persons being more open to working together, you know,
Mm,
that togetherness. Um,
hmm.
with any organization or any system, they're working with humans, there is going to be,
Yeah,
challenges.
yeah,
It's how we deal with those challenges is what makes a difference. So for me, what I would like to see is a bit more togetherness, among nursing and nurses, and just us helping each other, giving each other that push so that we can all get to where we want to be. And just to help each other make our jobs easier so that we can continue to enjoy it and not just do it for the sake of doing it, but to enjoy it and have that level of satisfaction and
yeah,
joy from
yeah,
doing it,
yeah,
because sometimes the job can be stressful in itself, and then when you have to deal with people that you're supposed to be working with, making it even stressful for you, that can be a challenge, so sometimes you want to feel at ease.
yeah, yeah,
And
yeah,
even though you may have had a tough day, you want to leave work knowing that I would have done a really good job,
yeah, yeah. I'm glad you used the word joy. Um, because a lot of people don't see that there can be much joy to it, but there is. There
Yeah.
is.
Yes.
There can be. Yeah. So I am looking at you, and you started by telling me that, you grew up kind of in a difficult situation, and here you are, pursuing a master's degree. You have achieved a lot along the way, and you still have big dreams to go forward. What would you say, though, is your greatest achievement so far?
So far, my greatest achievement, I wouldn't say it has anything to do with my career, but it's becoming a mother.
Hmm.
Um, I really did not plan on becoming a mother just yet, but things
Mhm.
happen, and I'm grateful. Motherhood has taught me a lot. I think it has helped me to grow as an individual and mature and, look at life in a different light, and it just brings me so much joy, and even in times when I'm sad, I still feel that joy. I still feel happy. I still feel comforted knowing that there is this mini me depending on me, to be there for her. So there are these little things that I look at and I'm like, I'm grateful for all of my challenges. I'm grateful for
Yeah,
everything that would have happened in my life. It has helped me to be here today
yeah,
and to be the person that I am.
yeah, yeah.
In my opinion, I think I have matured a lot,
Mm,
becoming a mother, because some of the things that you would do as a single person, not having any, that responsibility.
yeah.
Now, as a parent, you have to think twice, sometimes three
Mhm.
times before you make a decision. So for me, that is my greatest achievement, and I am proud of it. It it makes me happy. It makes me feel accomplished. You know,
Yeah,
and that's the most joy I have felt in my entire life. Of all the accomplishments I've had, that one brought me the most joy. It was so joyful that it brought tears to my eyes. Yeah.
awesome, 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 awesome. Um, so you want to have a center where to service children with special needs.
Yes.
Has your passion always been children?
No, no,
Okay.
it has not. It started out with just generally caring for people. in general, regardless of who it is.
Mhm.
But as I go along, especially when I did psychiatric nursing, I realized that, children are so vulnerable. They're so fragile. And for me, if you can help them from that stage, you can always prevent, other things from
Mhm.
happening later on in life. You
Yeah,
can help to give them a life that will, when they grow into adults, they can function and have meaningful lives and, do all the things that they want to do versus trying to care for an adult who has already gone through life, gone through different stages of life, and they are now experiencing difficult times. And then you now have to try and do so much work to help that person to be
yeah,
stable and to be, to continue to live a good life. So for me, it's like preventing the worst by dealing with what is there
yeah.
now.
I have one more question. What do you do for self-care?
What do I do for self-care? I didn't always take care of myself. I'm going to be honest with that. As a nurse, it is
You're
the
a
most
nurse. We
difficult
don't.
thing. It is the most difficult thing to do because you go to work and you find yourself working, 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 and then you be like, I did not have my lunch, or I did not stop to have my coffee break or my breakfast or whatever. But the day is done already,
Mhm.
and you end up with so many issues later on. But I have made it my duty, in recent times to stop and take that pause and take care of myself.
Yeah.
So regardless to how hard I work during the week, on the weekends, I take a few hours for myself. So even if it means going to my sister's spa and just have a nice relaxing massage, or I just sit at home and do my facial, or I just put my feet up and watch a nice program that I enjoy. And I have started practicing meditation, mindfulness meditation, which helps me a
Mhm.
lot with my sleep, with my mood,
Mhm.
and just my overall well-being. So I have been doing little things to improve, myself and take care of myself so that I can continue to function and be able to always have that drive so that I can do what I love doing, which is caring for people. Because if I am not 100, I won't be able to do what I need to do and make others better.
I got you. I got you. I ask that question of nurses always because I know
Yeah,
we don't take care of ourselves. Our mindset is to take care of others. And there's nothing wrong with that mindset,
yeah,
except that we forget to include ourselves in that
in
in
it.
that others thing. So I ask that question all the time. Donique, thank you so very, very much for this conversation. I have enjoyed it. I have enjoyed it. Perhaps we can do it again sometime. There's so many
Sure.
things I want to ask you.
And thank
But
you
thank
so
you very
much for
much.
having me.
It is my absolute pleasure.